Thank you very much. And actually, some of the points that Dr. Frogner has just made, we will take up in more detail in the next session. But we have time for some questions and comments on the framework. I see a couple. You were first, I think, in the pale green. Okay.
Hi, I'm Elizabeth Dorr. I'm the Associate Director at Johns Hopkins Source, and we are the Community Engagement and Service Learning Center. And so first, I just want to note that it's really wonderful to hear you talking about service learning and community engagement, reciprocal community engagement at such a level, because we don't hear it that often in these kind of environments. And so thank you for that. One point I wanted to kind of comment on and ask a question about is the research on such community engagement activities and education. Because we are a bridge center is kind of how we engage students, faculty, and the community, and we are this kind of bridge between these elements. And we're all practitioners, and really most of the people that are experts in the pedagogy are the ones that are doing the work out in the community and not doing the research. Mm-hmm. We are starting to engage with faculty who are a part of our Faculty Service Learning Fellows program to do research, but it really takes a collaboration amongst professionals to do that, because Mindy Levin is our director and I'm the associate director, and there are only 2 others in our center. And we've been lucky enough to get some increased funding, but it's not enough to have this research arm as a part of our center. And all of the faculty we work with are doing their other research. And so I just have to note that there is a really big jump between doing research on that education, given that there isn't as much investment in the practitioners doing that work or collaborating with faculty in those elements. So.
Yeah, thank you. And the report does take this up as a challenge. I don't know if you want to add to that or go to the next question.
I totally recognize the challenge that you're describing. And it's not just in terms of partnership with communities. We at the University of Michigan have a Center for Interprofessional Learning where we're engaged in what we're calling transformational learning, something we describe in the report as well. And the same thing happens. The instructors who are spending the time developing new curricula, new materials, new ways, innovative ways of teaching our students are concerned that all that work will not be viewed as favorably as traditional work because it's more time consuming, and therefore when it's time for their annual review, their promotion, their evaluation for at the provost level, that doesn't, because it's more engaged, the nature of the engagement and equal partnerships means it takes more time. It's not as the outcome is not as quick, or the traditional outcome of a peer review publication in a high impact journal. So we're at Michigan, and we discussed this here in the committee. We're having these conversations that there needs to be a shift, and we're seeing the shift. It's just being very slowly in terms of measuring impact. Community-based participatory research, one of the components that we describe in our report, is time intensive, time consuming, and it takes a lot longer to have to demonstrate impact, and at least in the traditional way. And that's where the organizational component comes in, where there's a need for this to work, there's a need for the other systems to understand and value and reward it, so that exactly the work you're doing that you described can be given equal value as the work, which right now it's not the case. We recognize, which is why this report is by setting the framework we propose, and the model is one of, as I described, an aspirational, a sort of an ethical value base a target of where we hope we're going to help move organizations and institutions towards.
Thank you. And I think this is the biggest challenge at Research One universities. when you get to the, particularly the Master's Comprehensive Carnegie classification, where many health professionals are educated, but not usually the medical schools, for example. Then you get the Boyer model applying, which does encourage very much this kind of work. I know we have a couple questions, but Adewale, you had a comment?
Just very, very briefly, it raises to the question of promotion and tenure, and institutional policies on promotion and tenure is an ongoing issue. If the university doesn't recognize your work as a service deliverer or a community innovator and build that into your decision about promotion and tenure, there's no encouragement for you to do it, particularly since the universities are very much into how much research money have you brought in, how many papers have you published, and then a very structured, traditional manner rather than what the real world is for us, which is about looking at social determinants and looking at community projects and valuing that so that I can get my promotion and be tenured from doing this kind of work.
Yeah, exactly. I mean, this is one of our big challenges. Patrick, the light's in my eyes, but I think I see that you raised your hand a moment ago.
Thank you, Susan. My name is Patrick Kelly. I direct the Board on Global Health here at the Academies. This is a fascinating report for me. Dr. Delva, you mentioned a few moments ago about measuring impact, and I'm wondering if the committee could elaborate a little bit more on their thoughts on how to do the evaluation of this type of work. I mean, as you know, there's a long educational process that would lead to change. The change isn't going to happen overnight. What would be the appropriate interim markers that you would look at that might give you a sense that you're moving in the right direction before you've actually seen improvements in health themselves? So I'm just would like you to elaborate a little bit more on the approach to evaluation, moving through the various stages of it. And also lifelong learning. We know that the bulk of the health workforce is not in school. Every year we only have a small fraction of the workforce leaving school, so the bulk of people who we would like to see become agents of change are sort of beyond the formal education. How does this report, other than inspiring lifelong learning, actually foster the understanding of how to address the social determinants of change and those people who've sort of moved beyond the classical degree programs? Thank you.
Thank you.
Thank you. That's a very, very important question. We talked a lot about that in the committee, and I've engaged in many, many discussions with my colleagues at Syracuse University and Upstate Medical University in Syracuse on this issue. We are already partway there, although I don't know if anybody's fully there just yet. But we've had cultural competency training and community engaged activities with students in collaboration with our Department of Health, Department of Social Services, community-based agencies, and then our neighborhood health center. And so we've engaged in the discussions of how do you look at community assets and community needs, not always having a deficit model for the community. That having been said, Syracuse has the most concentrated poverty among people of color in the nation. So we have a lot of issues to work on. So we've changed, at the very minimum, we've changed some of our evaluation documents that students complete and fill in to reflect that, hopefully to capture the changes in their attitudes, the changes in their feelings of competency. Of Of course, their feelings of competency are not necessarily their competencies, we know that. But we actively engage with the community members that they work with to see if the community members equally believe that our students are gaining competencies and are added value. We have a strong outreach to community members, and many of them come to school at Syracuse University through our part-time programs. And we keep trying. When I go back, I have a meeting that will be set up with the chief of police, the commissioner of health, and the superintendent of schools to look at the possibility of addressing the trauma that community members face due to overwhelming violence, especially gun violence and neighborhood violence. So we are ongoingly evaluating that. Our community members are co-authors on our publications. Although I think it's very important to just do the work, I think it also has to be published because we are engaged in conversations with people around the world. So everybody who does the work gets on our publications. We have authorship in the 20s, sometimes 20 number of people. But the chief of police has been an author on our publications. That, I think, helps them to have a say in whether our programs are working. So does that begin to address your question?
I hear you talking about sort of some intermediate outcomes,
Yes,
if you will,
yes.
and I think that does begin to address it. Yes, go ahead.
So I would also add that, as you're looking at the report, as we're starting to think about some of those intermediate actions and steps that can be taken, you'll see the supporting steps that people can do to align with each of the domains that we have. And I think those can start to be markers as well as to whether or not those actions are being implemented. I think also we had a lot of conversation about the lifelong learning and the fact that it doesn't happen in a very formal setting. And we think about where people are practicing as well and how that can also be incorporated into what they're seeing as opportunities to make sure that the lifelong learning is happening outside of those formal walls where someone doesn't have to be in a continuing education environment, but also where practice is happening. And again, that these are members of the communities themselves in which they are working, and how they can also collaborate with the community to support the opportunities for that as well. So those would just be a couple of things, sort of thinking about those intermediate outcomes are the actions that have been recommended in here to demonstrate support of the recommendations that we have being implemented could be some of those shorter term markers that we're starting to look at.
Yeah, thank you, Cara. Laura?
And talking specifically about evaluation, learning evaluation, in the report we talk about performance evaluation, and that's a very important issue because some of the schools we are changing the way we are teaching, and that's a good thing. But a lot of times you find that the teaching, the strategy are changing, but then the evaluation is the same. You end up by giving to the students just questions and answers, paper kind of test. So what we really are stressing in the report is that we really need to change the way we teach, but also the way we evaluate. We need to demonstrate the competency, not just to know about social determinants of health. They need to demonstrate that they understand them. And the best way to prove that you understand is maybe through a case study, is maybe through a work in the community, is through a project when you are demonstrating with your skills, your knowledge and your attitudes that you're working with, then you are really moving the evaluation to be more formative. Because what we have right now is the evaluation is just summative. At the end of the course, you have it or you don't have it. But what we're really stressing in the report is that we need summative evaluation, meaning that throughout the course, you have to demonstrate that you are beginning to understand the social determinants, that you're beginning to change your behavior, you're beginning to change the ways that we can address the social determinants of health. So I think this is a very good point. Evaluation should also be in the same parallel with the strategies that we're using to really change how we are training the students or in the workforce and putting the evaluation in the performance rather than just in the knowledge base.
Thank you. I think we have a question waiting at the microphone. Am I correct? And then I see at least one or two more hands in the audience.
Okay.
So,
Hello, could I make a...
Good morning. My name is Tiffany Mulder-Chiganyi, and I'm a public health analyst at HHS's Office of Disease Prevention, Health Promotion, and implementing the Healthy People Initiative. And I just wanted to provide a comment saying that this conversation is very timely and very just influential and imperative as we're looking at the mid-decade for Healthy People 2020 and looking forward to Healthy People 2030. And I think this is just a good opportunity for myself and my colleagues to look at our educational objectives and our SDOH-related objectives and how we're defining SDOH as well as our framework and how we can maybe redefine or realign our efforts, and also looking at how we can continue to move forward and kind of identifying what those quantitative indicators are and looking at where we've been and where we're going. So thank you.
thank you. That's wonderful to hear. I know there was a question over here earlier and then a couple over on the other side too.
My name is Patty Truant-Anderson. I'm a public health researcher with NORC at the University of Chicago. And I heard it was mentioned earlier that the educational goals are not only about increasing knowledge, but also about increasing, or about attitudes and motivations. And so I've been looking into this a little bit and looking into what we know about health professionals' perceptions of social determinants of health and disparities. And I'm wondering, this might be outside of your scope, but I'm wondering if you looked at that at all, and if you have any kind of comments about that. It might be kind of an important, if it might be outside of your scope, it's also an important kind of corollary to this discussion.
Okay. And there are two more at least. Do they bear on this same topic? Could we take them together, or should we quickly answer this one? And, all right, sounds like we go ahead and answer this one first. Maybe if one person takes this one, and then we'll go out again.
Sure. So that wasn't necessarily part of our scope. I think to some extent we talked about as the bidirectional conceptual model that you'll see in terms of who's coming into the education and how social determinants education is currently incorporated into the training that individuals receive, if it's formal, if it's an elective, if it's one course, if it's, sort of in that respect. But I think that we talked about as well, making sure that that experience with the community from that high level swooping in, that really isn't just coming in and we're telling you what you need to do, but it is that collaborative partnership. And that's why you saw in the community that they really were equal partners, because that was so important to making sure that they are learning about the social determinants of health and taking that back so that their experiences, we'll say, as opposed to biases, aren't perpetuated, but they really have that opportunity to learn and to see through there. But in terms of what current perceptions are, I think it was not necessarily part of the scope, but definitely part of the conversation of how we embed that in.
Okay. And did Dr. Fisher have a comment? Was that the indication? Go ahead.
Sorry, it was a comment to the gentleman's question previously. So perhaps I'll wait until these series have been answered and then perhaps come back to answer the question on lifelong learning.
Okay, thank you. I see two more questions that we have. Go ahead, and then one over here, and then we'll continue later. You'll have a chance for more questions.
Hi, Indira Paharia. I'm a board member with the Alliance for Strong Families and Communities. And I'm curious if when you were developing this framework, you looked at the community health worker model, because the CHWs are really on the front line doing a lot of this work. And a lot of the states in the US have certifications for CHWs. So my question is two-pronged. One is, did you look at those curriculum in thinking about this framework and developing this framework? And then the second is, because they're typically paraprofessionals and they're not enrolled in degree programs, is the framework, do you feel, applicable to this group? Thank you.
Okay. Sandy, I saw you nodding. You can take that one.
Yes, but I think Dr. Fisher also is probably eager to answer this question. Julian? No?
Yeah, no, it's an extremely good question, and it mirrors a lot of the conversations going on at the World Health Organization, touching on exactly as you say, that this group of professional or group of health workers are really front line and an extremely important group to include in interprofessional or collaborative practice. So yes, I think the model and the framework particularly does speak to that. I think it is generic enough to be applied within a particular health work cadre, or alternatively as an umbrella framework. So it was designed obviously primarily because we had a statement of tasks for health professionals, but we were very conscious that it couldn't just be health professionals, as has been mentioned many times this morning. It couldn't just be health professionals working in isolation. So when we designed it, we very much designed it for it being applied to other cadres, and also as a sort of a unifying framework, which is obviously the first slide I spoke to. So yes, it can be as an individual cadre, but also as a unifying framework. And the idea of the integrated curriculum, there are a number of areas where you will be linking in instinctively and inherently when you use the framework to other either cadres or other curricula. And by placing lifelong learning at the center, again, through your professional career or through your career as a health worker, you will start to understand how to work and the skills mix that will be needed. So yes, in answer to your question, we did look at that and take that on board when we were designing the framework.
Thank you. We're going to take one last quick question for this session.
Hello, I'm Allison Hickey. I'm the former Undersecretary for Benefits at the Department of Veterans Affairs. And I noted in your report the frequent comments many of you made about the sparse lack of evidence and the need for good case study. And having just done that job for 4.5 years and seen by design, VA is this complete wellness, full life cycle, socioeconomic, physical, the whole 9 yards, and understanding, having talked to the complete population health, I sometimes felt like, of veterans, they cared first whether they had money enough to put a roof over their head, whether they were food on the table, whether they had a job, and then they'll talk to you about their diabetes plan and whether they're being compliant with it. And so I would offer you this suggestion, and then I'd like your comment on that, because I see a lot of you all nodding your heads and smiling. One, did you talk to them would be my question. And two, I would suggest, if you haven't, they typically have a pretty good research budget. They have the largest number of social workers, I think, on the face of the planet. They're integrated into their patient-aligned care teams. And all of the non-medical benefits are part of that complete shoring up of this whole discussion. So I would like your comment and then offer that as a suggestion.
Thank you. Maybe one quick response, and this could be taken up also later on in discussion.
So at Syracuse University, we have a major program now for veterans, and it's collaborative with my college. We have many colleges at SU. And we're working specifically in an interprofessional way with this organization for veterans, with the veterans in classes, especially working on issues of exposure to violence. And so the short answer is yes. and we're delighted to be of service to the veterans and to have their expertise and input into our work.
Okay. I think that's very important, and you're right about the huge database there. Obviously, we're already starting to talk about implementing the recommendations in this report. It was hard enough to develop the framework, but to actually get people to adopt it is another story. And our next session is going to begin to talk about this, and it will be moderated by Dr. Jorge Delva. So we'll move into our next session. I'd like to thank the panelists, committee members who've spoken thus far. Please. And Dr. Delva, it's over to you.